Okay, I think we're going to let people continue to join, but I would like to start this evening. My name is Charlotte McNamara, and I am the head of the health department at the Kennel Club. We're really pleased that over 1,000 people have subscribed and want to watch this evening's webinar on epilepsy. Webinars are a fairly new venture for the Kennel Club. We have a series of webinars this year. And we will be providing more information after how you access webinars if you're not able to attend on the evening. We're really aware that quite a lot of people weren't able to sign up and attend because we did have that maximum of 1,000 participants. So we will look at ways to share this content with you and to make sure that everybody gets access. Just a couple of notes. If we can save questions to the end, we have received a large number of questions, and we will try to ask as many of those questions as possible to Holger and give time and opportunity for those at the end. But if you do have any raised hands, if we could save any sort of discussions or questions till the end of the session, that would be really, really helpful. Following this, if there are, I'll come back to it at the end, but if there are feedback or comments or ways you think that we could improve or enhance our webinars moving forward, then we will do. But moving on to the main focus and the reason that we're here this evening, we're really, really pleased to be able to offer a webinar on epilepsy. We know that this is an issue and a concern so close to so many people's hearts and of so much interest to so many people within the dog world and the community. Holger needs no introduction. Really, it speaks for itself, his wealth of expertise in this area. And it's really, really, we're really grateful and pleased that he's able to join us this evening. So without further ado, I will hand over to Holger, and we'll be back at the end of the session for questions.
Thank you, Charlotte, for the nice introduction. It's really great to be in Britain, even if it's remotely at the moment. So I hope you will enjoy the presentation I have, and then hopefully everyone will be able to join, and definitely some pinging noises. Good. Let's rock and roll. So what we'll do today is we'll talk a little bit about epilepsy. So I will give you some various insight. For some people will be some new stuff, and I hope, and actually a lot of the things I will present comes from many of my dog owner and breeder friends who kind of introduced some new concepts which we actually then at the RVC and now in Hanover are trying to answer. So you could be on the slide. So if you want to donate money to me, and if it's enough, then you can obviously be on the slide. So I have obviously some financial disclosures, and I will speak about some anti-epileptic drugs, but it's just something you have to be aware about. Good. So let's start with the most beautiful dog. So I'm sure everyone will say no, my breed is the most beautiful. But I will give you a little story, and people who have listened to me talking about epilepsy, I often start with Beauty, because Beauty was my own dog. So if you think that she's not beautiful, that's probably the moment you should let other people share this content. Saying this, I didn't name her Beauty, so she was a rescue Irish setter. And when I got her, she was, I thought, a healthy little dog, and she was 4 years of age. And then a couple of years later, I was studying veterinary medicine in France. She suddenly had a generalized tonic-clonic seizure. And the first thing I did, I ran to my car, I got a stethoscope, and I listened to her heart, and I obviously couldn't stop the seizure by listening to her heart. But as you can see, I was already a medical student, but I was so stressed about the seizure event, and I will show this again in a second, but seizures are unpredictable and uncontrollable, and everything we can't predict happening stresses us, right? And anything we can't control stresses us as a human being. And if you think about when the seizures often occur, so 60 to 70% of the seizures will happen at nighttime. So, and that's often at times when they go through different sleep cycles, and people who have had dogs with epilepsy, they know, that's normally around 4 or 5 o'clock in the morning, and suddenly they have a generalized tonic-clonic seizures. I learned a lot from Beauty, and I will take her as my learning lesson for you as well through this journey. And to tell you the good news ending, she was 17 years of age. So I don't think that a lot of Irish setters be that age. She was 17 years of age, and she had for quite a long time of that. Diagnosed with 5 years of age. So 12 years of epilepsy. I learned a lot, like I said. We used mainly drug treatment, but you will see that she will feature a couple of times throughout the presentation. So like I said before, seizures, they happen at any time. You don't feel you have control. And so one of the things I do with owners, and we're working on this at the moment, we're looking at new emergency drug treatments. And how we can give you more control at home to stop the seizures. Saying this, a seizure is normally self-limiting, right? What does it mean? You have a certain phases during the seizure event, and it will stop because the brain is really good in stopping that seizure activity. So what happens is normally you might see some behavior change. They might seek attention, they hide. You think, there's just something not right with my little friend here, and then they start to stiffen up. They get stiff. And then what happens then, as you can see also in this dog, they stiff. And then what happens is that they start to have those tonic-clonic type movements. And then at the end of the seizure activity, they start looking really like a running type movement, right? So they, and during that time, it's always obviously good to have a Jack Russell Terrier who likes your urine, right? So during that time, they can lose urine, feces, and so on. And that's a very typical thing. The other very typical thing is that they hypersalivate, right? So first learning thing is seizures often are stereotypical, and they have different phases, and they come from a very stiff, often in a generalized tonic-clonic seizure, to running type movements at the end. That's kind of the typical one. And then what happens after the seizure? You have the post-ictal period. That's the time after the seizure event. And this is where some challenges are. People sometimes confuse them with the seizures, but the seizures are the ones we see are normally motor seizures. So they have some type of movement, and when they stop, then often the post-ictal period. So they can be confused, they can be very hungry, some dogs are aggressive. That's all post-ictal type of behavior. It's the computer being totally ramped up, and then you just have to reboot the whole system. And taking this rebooting takes some time. Normally a couple of minutes, sometimes a couple of hours, sometimes a day or so, right? So when you look at the seizure event, look at the movement part, and that normally tells you, especially when they have a generalized tonic-clonic seizures, when they stop running, that's probably the end. And why is this important? Why do I say this? Is because we know that the seizure itself does not really harm the brain if it's around 1 or 2 minutes. However, if you have multiple seizures a day, what we call cluster seizures, or you have a prolonged seizure activity over 5 minutes, and definitely when it's over 30 minutes, then you can cause brain damage. And that's why it's so important to really understand when it starts and when it finishes, because then you also know when you might have to do a rescue treatment, like rectal diazepam, intranasal midazolam, so which you need to stop after 5 minutes, the seizure activity. Alrighty, good. So why is epilepsy important? Obviously, it is important. As you can see, there's many people joining us today. We do know that epilepsy is associated with reduced quality of life of the pet and the owner. We know that when you're diagnosed, you have normally 2.5 years of to live. After most people will not tolerate very long the chronic management, and you can also get some behavior changes, but more to that in a second. This is a really interesting study with Annette Westman and I did. And in the beginning, I didn't understand it 100%. And actually, a good friend of mine, Robin Farquhar, who has a first opinion practice, she kind of enlightened me. So the first thing is, when we asked owners, what do you think the most influential in the quality of life of your epileptic pet? And I said, okay, high seizure frequency and receiving multiple anti-epileptic drugs, that normally affects the quality of life. When you ask them, on the other hand, what affects your quality of life, because epilepsy is not only a disease for the pet, it also has a huge social interaction and impact into your life, owning such a pet. And there it was sedation level and ataxia. And that's where Robin really helped me, because I thought, because Beauty at the end, she was urinating into the house. She was when you get old, you have a more likelihood of losing urine, and when you are on phenobarb or potassium bromide, you drink a lot. Because you drink a lot, you pee a lot as well. And because of that, I thought that might be quite life limiting, because that is actually quite a thing. And because your dog wakes up in the pee sometimes, it's not nice for anyone, right? But sedation and ataxia, so as more wobbly, ataxia means wobbliness, sedation means that they're more sleepy. That was the ones which affected really the people, right? And it makes sense, because you see your dog is suffering. And the interesting thing, these are the ones which are mainly done by drugs. And so what we try to do nowadays to balance the side effects, that you don't have too much of the sleepiness, too much of the wobbliness, but still have a good seizure control. What is really interesting as well is what actually impacts quality of life. And there's a nice study here from a very good epileptologist, Karen Munyana, and she said, okay, so in my study, it was quality of life was affected by seizure type, so multiple seizures, seizure frequency, very similar to our study, side effects, very similar to our study, right? And the interesting thing, what I was, and there might be a bias, because you never know when you do these studies which group of people you get, but the cost of the treatment was not as much. The other thing is what I thought was really interesting, and I would definitely, and that's something you can give the advice to the owners. There's a huge impact for people finding the right vet, the vet you trust. Doesn't have to be the brightest on the sky, but someone who listens to you and works with you together to do the best for the patient. And all the vets, they want to do the best. However, some are more open, especially epilepsy is a frustrating disease. You don't feel also as a vet you have control sometimes. And so you need to find the right toolkit for this individual patient to really nail it down. And the interesting thing on the study was that they showed that actually people do trust the vet, which I'm glad, because it's obviously my profession that you guys trust us. And also that if you do and you find this right vet, that it actually improves. And I'll show you in a second why this is so important. But also obviously good education, as also the Kennel Club does, and other groups who do really solid in layman's terms, for everyone understandable. And the other thing is, and that's why I'm so honored and privileged to be able to speak to all you guys, because what you are doing is just fantastic. Because as better you feel informed, as better you can also help and advise. And it is the fact that the normal owner might not dare to ask questions to the vet, or understand everything the vet might have said. And it's often the information has to come from people who know the business and who can understand and help these owners as well, together with obviously the vet. So this is my Anna. Unfortunately, we lost her this summer. She was we did a nice trip through the UK and spent some quality time with her this summer as well. But you also see my little daughter. This is now 2 years ago, but she's still little, as I still have small children. And one of the things she does there, I think there's no question, and all you guys know it, and that's an important fact. Perhaps it's not as much in epilepsy, is dogs love children, right? And you guys know why? Because they have a really strong relief of oxytocin, this love hormone, and dogs can smell that, right? As you know, we do a lot of smell research as well, and there's a big bond. But why do I show this picture? There has been Rovina Packer and I and some other folks have done some really interesting study where they have correlated stress in pets with the ones in owners. So as more stressed an owner is, as more the pet is stressed, and vice versa. So why is this important? We do know that when you have certain stress level and suddenly a time of relaxation, that then often seizures occur. So there is a interlink in getting high arousal of the brain, and then suddenly get a slowdown, and then the brain can synchronize. So having not only trust to your vet, but what it does, it makes you calmer. It makes you feel more controlled. It makes you feel that you have the disease better under control. And because you are calm, this also will have an influence on your pet's epilepsy. This is a study which is now also published. This is just a poster of it. We did a qualitative interview study, and perhaps some of you guys have helped with us. And Amy did a great job. And it was, the paper at the end in BMC, we had the title, we have a ticking time bomb, because some owners they don't want to leave the house anymore. They have no social interaction as much as they could have. They don't go on holiday. So it's a really strong commitment to these epileptic dogs, and that's something we are trying to work on, how to help you guys and also help the vet, who also are very frustrated. So what is the new concept of treatment and management of epilepsy? So the first thing is obviously a workup, so we know that there's no other cause of the epilepsy, and we will talk about this in a bit more detail. So we have epileptic seizures. So epilepsy is defined as having 2 epileptic seizures 24 hours apart. And when you have those recurrent seizure activity, there's millions of reasons why this could happen. There could be something wrong in your blood, and something with the organs like the liver. There could be a problem of a structure like a brain tumor, inflammation, and so on, right? There's multiple reasons. But we will focus today mainly when there is nothing we could find, when that is called idiopathic epilepsy. So we ruled out all the other diseases which can cause epilepsy, and we can't find anything, and that's called idiopathic epilepsy. And we talk in a second, because I know there's also quite a few questions about the genes and the genetics of epilepsy. There are some families which will have a higher likelihood of becoming epileptics. So what do we do nowadays? Nowadays, when we manage epilepsy patients, and like I said, it's a lot thanks to your feedback, we look not only at the epilepsy characteristics, we look at management options like drugs, but we also look at how the nutrition might play a role, and I will have some words about this. We look at how the brain develops and ages, because this can be altered in dogs with epilepsy. Do they have any changes in their behavior, which we might have to address? And like I said, underlying causes, and what's the environment. So what is epilepsy? So, it's always the classic one, is a complex simplicity. We try to simplify it. So we try to make the we try to square a circle, because whatever I will tell you in a couple of years, I might tell you something different, but I will try to make it very, very simple, right? And that means that not every definition is 100%, right? So it's a simplified definition. So the first, there are two principles, and if you understand those two principles, you do understand epilepsy. Yeah. So let's see if it works. Ah, fantastic, right? So some people say that your brain is on fire, or your brain has an electric storm, right? But I always feel like this is something very difficult to feel. So when I would give you this presentation in face to face, I would ask you guys to clap, right? And when you have a big crowd, and you might have seen some football, whatever, a rugby match or whatsoever, people clap and they're all like, yeah, cheering. And after a while, they will all clap together, right? And this the same happens in the brain. The brain normally, you know, in this moment, you are listening to me, you might hear something, you feel something, you smell something. Your brain is working on a lot of information, but you might have this epileptic focus, and it's trying to recruit the other neurons. You have, you know, a group of fans in stadium, and they try to recruit the others to clap with them together. These neurons are called pacemakers, yeah. And what happens then, as when all the brain is firing at the same time, then you have the epileptic seizure, right? And that's why you see this certain rhythmicity, because your normal brain activity, I mean, might be different in yours. You know, there's a lot happening, and there's a lot of nice noise coming out there, right? But a seizure is more like this, right? So you have a hypersynchronization of the neurons. Okay. So I call it the Queen principle. And when you look at the International League Against Epilepsy in the human field, what they call it is the hypersynchronous activity. So the neurons are firing at the same time. But you also need to have a little bit of a yin and yang, balancing between, you know, too much brain activity and the brain activity, dampening the activity, so excitation, inhibition. And I find this the easiest to explain if you have like a focus, like a fire, right? And surrounding this fire, you have lateral inhibition, so you have water, right? And so what happens, so if you think about, let's say, a brain tumor, then around this brain tumor, all these neurons are constantly altered. They want to get the other neurons, the other fans to clap at the same time. And what happens is either the pathology suddenly grows, right? And then and you overcome this water, and then you have a seizure, or the opposite, right? Suddenly the inhibition goes down. And this is what I said earlier with the stress. So dogs with change in lifestyle, a lot of stress, a lot of hyper, and then suddenly calm, might have this inhibition going down, and then they have a seizure, right? And just so you're all awake, right? A little bit of We Will Rock You. Fantastic. Okay, two principles, the Queen principle and the Yin principle. And these two principles, actually, you can explain, and we're going into the pharmacology, but if you understand them, then you understand. Because what we do when we treat and manage the disease, we try to stop the hypersynchronous activity, and we try to actually, at this moment, mainly increase inhibition. Right. And as you guys, I'm sure you have seen people drink alcohol. I'm sure you are not drinking any alcohol yourself. But when you drink a lot of alcohol, that works also on the GABAergic neurons. These are the ones which we are using as well when we give them phenobarb or other anti-epileptic drugs. And you know what happens when you drink a lot more alcohol. You get ataxic, you get sleepy, you get, you know, you might have decreased pain sensation, and so on and so on, right? And the same happens actually when you give those drugs, because they also work on these receptors. Good. A couple of other things, and not going too much into detail. So normally, in the normal brain, a neuron would give information to the next neuron and say, hey, pass on this information, it's important, give it further on. And then it goes to movement or vision or whatever it is, right? But what the neuron does as well, it controls its own activity. So by giving information to the neuron in front of it, it will also start reducing its own. So it's a little bit like a government, right? So you have someone who's in the executive power, but you still have the balancing between the legislative and the judicial, right? And sometimes works better in some countries than others, or we kind of have a shift at the moment. But that's what happens in the brain, right? So you need some action, but then you need to also have some regulation. And if this regulation doesn't work anymore, then you have seizure activity. A couple of other things which I think are really important to understand the disease, because you can always blame your parents, but you can't, right? Because the genes, and you will see that later, there are only very few single genes being identified which are causative. That means if you have this gene defect, you will get epileptic. Genes are probably more likely to be risk factor. And then you need another hit. So this, people call it the 2-hit model. You know, for example, there's a failure to repair, or you have suddenly also a trauma and you have this gene defect, or you have a trauma and then you have a failure to repair and then you get it. So there's multiple things which might happen to start you having epileptic seizures, right? And there's different parts. So the first one is when the epilepsy develops. At the moment, there's no treatment really for that. Levetiracetam, people, Capra, discussed if that could be. And then you will have the chronic phase. Epilepsy is a chronic disease. And then it can progress, and sometimes it can become difficult to treat. So let's talk a little bit about genes. And I have to give you another little story about my own life. So I hope you don't judge me. I'm sure you will. So I'm the person who cooks. So I have a very weird working life balance, and I come home and cook for the children and my wife. And but one of the things I can't do is baking, right? So, and my wife, it's phenomenal. So baking shouldn't be so difficult, right? So you have the ingredients, yeah, you have the genes, and you mix them all together, and then you put it in the oven, and my wife does it, and it tastes fantastic. And if I do it, it tastes like I won't say it, right? And I don't understand, right? So I use the same ingredients, I use the same genes, but the one is this way and the other one is the other way. And this shows you, yes, there are some genetic factors. It's like having another metaphor is having a stack of cards, but the question is how you play the cards, right? How you play your genes, and that's something people are getting more and more interested in. It's not only what you were born with, but also what happens during the course. And we do know nowadays that environment and can have an influence in the gene expression and the alterations. So as you might know, I said to you earlier, if you rule out everything, so you did the blood work, it's all clear, you did even an MRI scan of the brain and it's all clear, and the dog still has seizures, then it's probably most likely idiopathic epilepsy. But it does not mean it's one disease. It's just a title that we couldn't find the cause in this. With our current diagnostic test, we couldn't find it. Some people have then gone into more detail and said, okay, idiopathic epilepsy, we have 3 types. The one which is definitely by a gene, the one which is presumptively by a gene, and the other ones we don't know and are unknown. But the bottom line is it's a bucket diagnosis, right? It only means we couldn't identify anything. We did a new classification which you can download for free at BMC, and won't go into too much detail, but you can see there we had these three types for idiopathic epilepsy, and then we had some classic breeds which I will mention again in a second. But you had the Lagotto Romagnolos, which have a certain gene defect. Then we found some Belgian Shepherds, which have also a gene defect, and we come to this in a second. Yeah. So the Belgian Shepherd, there is and this is an interesting thing, and I come back to this in a second as well. But the ADAM23, it's a gene, and actually what they found is that it's more associated with drug refractoriness, so not responding to drugs, than actually causative of the gene. So it's more like a risk factor gene, right? Where it's a bit more clear is this one beautiful study from Andrea Fischer and Hannes Lohi. Franziska Wieländer was the postdoc students. And in these guys, we have a very different, if you think about the dog I showed you in the beginning with those generalized tonic-clonic seizures, in this dog, we suddenly had these myoclonic jerks. So there's a kind of a muscle group which is jerking, like jerk. And these guys, they are also photosensitive. So when you flash light or go into with a sharp light, you can actually trigger them. And they are also actually, some might be even a bit noise sensitive. But what you can see on these is very specific phenotype. This is not your normal generalized epileptic dog. They have a very specific phenotype. And you find this for the ones we found genes, for the ones we found that when you have this gene affected, then you will have an alteration and you will actually have a phenotype. They have very specific phenotypes, yeah? And this is the other one, which is a very specific phenotype. These are the Lagotto Romagnolos. What happens in those dogs, what we call also a benign childhood epilepsy. Benign childhood epilepsy because they grow out of it, right? They stop having seizures. And the interesting thing on it is that there's like two genes, right? The LGI1 and LGI2, and they have an LGI2 truncation, and because of that, the neurons cannot connect properly to other neurons, okay? And what you see is that, you know, after the 10 weeks of age, they show multiple signs, not just seizures. I know we often simplify it, but, you know, they're ataxic and they have, you know, a little bit of cerebellar signs, a little bit of head tremors and so on. So they show multiple problems there, okay? And then the interesting thing is the other gene, so LGI1, takes over the action. And when it takes over the actions, then actually they, they can actually do this pruning of the synapses, of the neurons connecting again, right? So it's just a delay of development, right? And I have a little synapse on the bottom here. Can you see? This is the LGI1, and then you also see the ADAM23, which I showed you earlier. So this might be a really important complex in dogs. And I'll show you another reason. We know in cats, so we are not talking about cats today, but in cats, we can get a very specific epilepsy type. They have symmetrical focal seizures. And what people have found is that in these cats, there are some autoantibodies against voltage-gated potassium channels. And the interesting thing, again, you see there's LGI1, right? So there is a little bit of a complex which is important in canine and feline epilepsy. Okay. We also know that there is in the Belgian Malinois, there is a very specific one. They're also quite aggressive, these dogs, when they have this polymorphism in a dopamine transporter. Dopamine is the hormone which makes you happy when you watch television, right? So when you watch television, you can kind of get in the zone and you feel really relaxed and confirmed, and that's the dopamine does that. So obviously, you know, when there's an alteration, it will attract your behaviors, and this has been in Belgian Malinois described. In Border Collies, there has been a subtype of a certain brain transporter being described, which makes them more drug resistant. So much information, right? So much information. And I'm sorry, but I will continue rocking through enthusiastically, but you've done really great. So let's talk about food. I didn't have proper food yet, so I hope you guys can eat during I give a nice lecture here. I love to have this spaghetti, and all my students in the UK, we made jokes about how you're cooking spaghetti, but this is another way to understand epilepsy, right? We talked about the hypersynchronicity, the we will rock you, the Queen principle. We talked about the yin and yang. But this is another way to think about it. So every brain can seizure. Every brain can have an epileptic seizure. And actually, it's not uncommon that we might have had one in our life. At night, probably no one realized, and we are fine again. And that doesn't mean that your brain is diseased, right? It's just a reaction to it. So I think there's no question that you can boil water, right? I think every one of us has boiled water. The question is, which water will boil quicker? The one where you add a little bit of salt, or the one which you boil first and then you add salt, right? And the interesting thing is, when you ask this question, you know, there's a lot of discussion because it depends actually how much salt you put in. But if you put a little bit of salt in, actually it boils quicker, right? It boils quicker. And the thing is, what you have done is you have changed the propensity of the water to boil. You have changed the likelihood of the water to boil by adding a little bit of content, right? And the same happens with disease. So you have a disease in your brain or a gene defect, and it just lowers your seizure threshold. It makes you more likely to seizure. And what we do with the drugs is to raise the seizure threshold again, so it makes you less likely to have a seizure again, okay? So it's a little bit like cooking spaghetti. And Lennox, they you know, when you look in old textbook, it's always some fantastic thought process. And they had a different metaphor. They compared it to flooding, right? They said you have all these different risk factors. You have your genes. We know that being male is actually bad when you are a dog. So male dogs are more likely to get epilepsy. Male dogs are more likely to get drug-resistant epilepsy, right? And it might even appear that the neutering might enhance this effect, but there's more needs to be done in research on that. But we come with a bag of luggage, right? We come with our genes, we come with our ingredients to make those gingerbread mans, we come with our stack of cards, whatever metaphor you want to use, right? And then you have other factors, perhaps they come together, and then you will have too much water going down the stream, going into the river, and then you might have a flood. And what we do is then we create bigger river walls, right? And to kind of higher that and make it less likely for flooding. And that's what we do with the drugs. Yeah. So this gives you another way of thinking about the disease and hopefully helps you. So we did this epilepsy tracker, which is still available. I'm not in charge anymore, so you have to talk to Rena about this. But we did this, and multiple reasons for this. And one of them is, and this is probably the most important, perhaps, to take out today. And whatever we can do to change it, we know that only 1 in 5 dog owners give the medication 100% correctly. So 20% only. 56% overall compliance. That's really rubbish. That's really like you would give a painkiller or an antibiotic. It's the same rubbishness. So people don't give the drugs. And the thing is, when you have long-term phenobarbital, which is the main drug which we use still for epilepsy, and you suddenly stop it, you might get withdrawal seizures, because it's a little bit like when people drink too much alcohol chronically. They will need the alcohol to stop having the tremor. The same is your brain will depend on the phenobarb. So when you stop it, you will have withdrawal seizures, right? And that's why we developed the app. We also developed it to obviously get some information and be able to track the disease process. So, but when we launched the epilepsy app, we had a really interesting lady giving a presentation. She had seizures herself, and she was, you know, talking about it, and I gave a presentation, and remember Luisa De Rizio, when she was at the Trust, still gave a presentation as well, and she was like, wow, Holger, this is really interesting. You talk about all the drugs, but you know, the side effects, they were quite severe, and you know, it took me a long time until I found this one physician. So she started to have epilepsy when she was 14. And 20 years later, she became seizure-free because she found the one clinician who did this concept, which I just introduced to you. But the interesting thing was, she said, look, you know, one seizure you have from time to time, and it's bad, it's a bad day, and so on. But, you know, you recover and it's okay. But with my side effects, and with my comorbidities, which we'll discuss now, I have to live every second of my life. And I was like, wow, wow, I never thought about this, you know, because as a neurologist, you give them pills and you send them home and then hope that they don't come back, because obviously when they come back, the disease got worse. But we do have to think about it a bit more holistically. We have to think about it to say, okay, it's not just the seizure control. We also have other things. And actually, owners were a lot more perceptive than all the vets out there. You did a far better job. And when you ask people with epilepsy, they will also tell you what else is epilepsy apart from seizures. They will tell you, you know, depression, ADHD, memory, anxiety, and so on and so on. So there's more to epilepsy than actually the seizures. And nowadays we think epilepsy is a brain disease affecting your brain in multiple levels, and also obviously causing the seizures. So we did ask you guys, what shall we do next in canine epilepsy research? And we have tackled on many of these factors. You know, we've done nearly all of that. But when we did this, we also compared you guys to vets and vets to specialists and so on and so on. And the interesting thing, if you look at this, the vets, the specialists, they were mainly compared to owners. They said, oh, how do you classify this and so on. But the owners already said, hey, look here, the side effects are really important. Yeah, the specialists might not care so much about it because, you know, it's not in their main focus because they want to stop the seizures. You guys knew already, and specialists didn't, that dogs with epilepsy, they get more fearful. They are more anxious. And they have limitations of physical capabilities. And the same happens when you compare yourself to primary care with specialist vets. The specialists, they want new drugs and gene and seizure detection. And you guys were a lot more perceptive compared to the primary care vet. So, principle of Corey, you know, a seizure happens. It might be a bad minute. It might take a couple of hours to reboot, but then you're okay, a little bit sleepy. But what do we do with every minute? It is unpredictable, uncontrollable. It's the one which confirms the disease, but there's a bigger picture to this, right? And when you go back to history, you can see that there have been many who have already looked into this. So Hippocrates already said melancholics are more likely to become epileptics and epileptics melancholics. And then when it comes into more our times, and you know, Aubrey Lewis was kind of the first who really nailed it down and said, okay, guys, you know, there is a direct interlink between people who have depression or anxiety more likely to become epileptics and vice versa. Oh, I don't have this slide in there. But it's normally it's like, you know, quite a high chance, 20% of them to get it. In dogs, it's even higher, right? We know that 70% of dogs developing idiopathic epilepsy will also have especially anxious type of behavior. And it's mainly that they're afraid of strangers, other dogs, and interaction with strange objects. So it's mainly the fear of the new or the different, which makes them, you know, being a bit more perceived. And this is interesting because nowadays, and I spoke to you about the benign childhood epilepsy, and Taija did a great study in Finland. Yes, they grew out of the seizures. Yes, they didn't have really epilepsy anymore. However, when she looked at them 5-6 years later down the line, they had problems with their impulsivity control. They had problems with their concentration, very much similar to ADHD. And we have seen something very similar now, also in our dog population. So, cognition. As I said to you before, you can see my very wise little beauty here, right? She's standing there, looking into the horizons, being wise and probably being very annoyed about the youngsters playing in the background. But yes, epilepsy, you know, here she's obviously ancient. We know that older dogs do get cognitive dysfunction, but we also know, and this is an interesting study, and you guys have helped to fill it in, and I'm sure many of you have done it, This was a study we done, Rowena Packer and I, and it was a great study because it was an adult dog owner questionnaire. And at the end, so we didn't focus only on epilepsy patients. At the end, there were two things which featured. So dogs being 12 years or older had more problems with trainability, and dogs with epilepsy. So epilepsy does not only change your fear and anxiety type behavior, it also changes your cognition. And I explain in a second more. So they are less likely to be trained. You know, it's not massive, but they might not obey us easily and so on. And why is this important for me as an owner? It's just to be a bit more patient with these dogs. And we also found that positive reinforcement actually had better, higher trainability. Yeah. We also found that certain drugs, and there's a new study which has confirmed that zonisamide has an influence. We also did a canine cognition. There's like a one for demented dogs, for elderly pets, and again, epilepsy featured. So we have two confirmation assays. And we did a couple of tests now, and we've repeated this now, that especially the spatial memory, the memory in the room is altered in these dogs, right? And this makes totally sense when you look at the brain structure which is involved, and we won't go into a lot of details, but you can see that there's a part missing here. And so we know that certain areas of the brain which are important for learning, the hippocampus, and which are important for anxiety and so on, or not having it, is the amygdala, are in these regions which are affected often in these dogs with epilepsy. So what do? We know that dogs, some dogs will have triggers. For example, stress. Most owners, we did a vet record paper, shown that stress is a really big influence. So removing stress, having a constant lifestyle, having routines is important. Antiepileptic drugs, we'll have a couple of words about this in a second. And nutrition plays a role to give more a holistic approach, right? We do know, and here in the red is all the ones which are the drugs which have used. Oh, ignore the red dots. They have somehow shifted, but I will show you a slide in a second. But what I want to show you with this slide is there's been many drugs developed in human medicine. And the main difference between the ones nowadays and the older ones, like phenobarbital bromide, is the side effect profile. So you're a lot more tolerated the drugs which you can use now than the ones which have been used before, because they have more side effects. Yeah, they didn't improve necessarily in efficacy. We did a systematic review. This is now, as time is ticking along, right, a long time ago, 8 years ago, where we've shown that there's good evidence for phenobarbital and imipitoin, Paxion, and some solid for potassium bromide. For levetiracetam is more evidence for add-on treatment. For single use, not as much. And zonisamide, there's not so many studies, but we know that in the US they use it a lot, saying this is very expensive in Europe. We do know levetiracetam has least side effects. Potassium bromide has the most of the drugs we are giving. And the question is, when do you start for treatment? And I see it all the time that people start very late. Most owners will tolerate one seizure every 3 months, so 2 seizures in 6 months' time, and that's was a Glasgow study where they've shown this very nicely, and that's what we have used in the past, saying this. A lot of owners want to treat more aggressively. Some people are really not bothered, but the problem is, as closer the seizures are together, as less like the animal respond. So that's why we are afraid of status epilepticus, so prolonged seizures, what I said earlier, or if you have more seizures a day, because these guys drive the disease and make it more difficult to treat them and make them drug resistant, right? So you don't want to get to that point. Single seizures are normally not harmful, but when they come closer and closer to each other, you need to be aggressive in your treatment, right? And that's why we say dogs with cluster seizures, status epilepticus, they need to be treated if they have severe post-ictal signs. You know, I had to unfortunately put some dogs to sleep because they were aggressive. The structural lesions, because they're more likely to result in status epilepticus or cluster seizures. And always when there's an increasing seizure frequency, but not just waiting for 3 months, right? Monitor it for longer, because you can have 3 months waxing and waning. So 6 months or longer is a good time. And this is from the ACYM, from the American College, where I've also been featured off in the board, coming to very similar conclusions. We do know that 60–70% of dogs with epilepsy are safe sailings. You get them seizure-free, but there are some Titanics out there. These are the ones which cluster seizures, having multiple seizures a day, status epilepticus, and the ones which get closer and closer seizures, and they can be very, very, very tricky to treat. Yeah. Remember, idiopathic epilepsy is not one disease. So even if you use, the drugs, they're very dirty drugs. They're not specific for that disease. They're only suppressing the seizures. They're only making it less likely for the water to boil, making it less likely for the brain to seizure. So let's talk a little bit about diet, because this is something I started thanks to you guys. I gave traveling country, giving to a couple of breed clubs talks about epilepsy and so on, and you guys were saying, hey, it's all about the diet. And I'm sure I won't go into detail because there's a lot of emotions about the right diet, and I'm not talking about, but I thought there is something to it, and I had some quite owners and they were like, we changed it and suddenly it all improved. Yeah. So we do know potassium bromide is one of the antiepileptic drug, and it's actually a salt. And actually the body confuses bromide, so potassium bromide, with sodium chloride, with a normal salt, with a table salt you have. And you kind of, by salting the body, you make it less likely for the brain to have a seizure. And there's some reasons for that. But what does it mean for me? We do know for a long time that when there is too much salt in the diet or variable salt content, then you will have variable uptake of the drug, right? So, and I had this before, that people gave various diets. They might have had a standard diet, but then gave pizza from Pizza Hut, which has a lot of salt, or chips, and then suddenly you jam up the salt content in the diet, and then the drug actually can't enter, right? So be careful about that. The other thing is, we do know that dogs living at the seaside, and there's a recent study from Paul Mandiger from the Netherlands, that these dogs actually have lower levels of bromide concentration. So the salt content does affect directly this drug, and that needs to be considered, and they have to have a constant diet. We did a study where, and this has been known for a long time, and we did a study then to say, okay, what do people actually use as a diet, and what do they change, and why do they change it? Yeah, and interestingly, 2 out of 3 owners, and you have to be careful because these are Facebook questionnaires, they did actually change the diet or provide dietary supplement. And they did it to kind of protect the body, to make sure the body is safe. And also did it to improve a little bit of seizure control. Also might have improved for the anxiety levels, right? And when you look at what did they give, and is mainly oils, so omega-3 fatty acid and medium chain triglycerides, coconut oil, which we talk about in a second in a bit more detail, and some other vitamins and so on. So we know for a while that owners do change the diet. We do know from human medicine that especially ketogenic diet, so when you are in ketosis, so you have a carb-free diet, so to speak, then you're more likely to just have ketone bodies, and we know, or when you starve as well, you get these types of energy resources from your fat, the ketone bodies, and they're really highly effective in your brain. They make your brain work really well, and they can be anti-seizure as well. So we did a study using medium chain triglycerides. These are not short chain fatty acids. They're not long fatty acids. They are just medium. So C8 to C12, and mainly C8 and C10. So 8 or 10 carbon in the chain, they will have actually the main effect, right? So don't use coconut oil, because coconut oil has also long-chain fatty acids. Use the purified one, and the ones, there's now diets commercially on the market, but also you can buy the oil in the supermarket. You can look at the publications to find out the dose, what you have to do. But what we wanted to see and we did a study which we designed very similar to a drug trial. So we didn't, we used the diet like a drug in difficult to treat patients. And at the end of the day, we found that, and this was surprising, I have to say, so this was difficult to treat patients on standard anti-epileptic drugs, most of them on phenobarbital, I think all of them on phenobarbital, sorry, and most of them either on imipitoin and the majority on potassium bromide as an add-on. Some of them also levetiracetam. So they had multiple drugs on board, difficult to treat, and then we gave them the diet and compared a placebo diet to the diet in the same dogs. And we had 14% of them became seizure-free. And when we continued in these dogs, the diet, they were quite good. Around half of them had more than a 50% reduction of seizure frequency. And this is like you would give another drug, and it shows you how powerful nutrition can be, right? So we've done multiple drug trials where we've given another drug, and we had some very similar outcomes, yeah? And then we did some crazy thing. We repeated the study, which is very, everyone always in science says you have to repeat studies to make sure that they're true. So we did this, and then suddenly people didn't want to publish anymore because we already published it before in a different cohort, sorry. And actually, we confirmed the first study, exactly the same. In this study, however, we added the oil over the food. It was not in the food, not integrated. And then we did another study on non-clustering dogs, because most of the drug-resistant patients, they have cluster seizures. So we wanted to see how is it in dogs without cluster seizures. And again, 30% of them responded very well. And how does it work? So we know, and if you guys have done this, so if you do like starvation or have used a low carb diet, you know that actually you get more awake after a couple of days, because people always thought that the blood sugar and the brain uses 20% of your sugar levels. And we thought that it's really important for the brain to have this sugar, and it is, because it's mainly for your supporting cell, for the glia cells, or the glue in the brain, so to speak. But the neurons themselves, the nerve cells, they actually work a lot better on alternative energy sources like those ketone buddies, 4 to 6 times. And people who have done a diet like that, they will say, oh, I was tired in the beginning, and oh, I felt bad, and I had a headache. And then they continue, and suddenly, whoop, they're awake. Yeah, and they're more awake than they used to. And we all know this. When you eat a lot of sugar, and you get really, you get an insulin peak, and you get really tired. And the interesting thing is, when you have this epileptic seizure, during a seizure, you have a lot of sugar consumption, and this would be normally in the figures C's red, right? But these are between the seizure events, and you see that there now this area which I showed you earlier at the bottom of the brain is blue, right? And that means actually it doesn't consume as much sugar, and that could explain you why you have these alterations, because you have an altered energy supply in that brain area. So when you give them alternate energy sources, then suddenly your cognition, your fear, anxiety type behavior gets better, and your seizure control gets better. We also know that some of these oils actually work directly on the excitatory, so an enhancing side of the nervous system on some receptors. So, and all our anti-epileptic drugs work mainly on the inhibitory side, on the GABAergic side, like alcohol. Yeah. So we have shown that memory task is improved with this diet, and we have shown that ADHD and some anxiety types is improved. So the dogs are just better, not only better seizure control, but also other factors. So let me think. What do you guys think here? This is a little friend who came to the RVC, to the Royal Vet College, with those little twitches. In the beginning, we didn't know what it has. And then we questioned them more. The parents were not at home. The kids looked after the dog. And then we learned that the dog was fed space cookies. So this dog had a marijuana intoxication, right? Had some space cookies. So as people, dogs having this, they can either be hyper excitable, so hyper, or they can be just sleepy and dopey. So, and I know that people will ask, what about cannabidiol? And I will just show you what the evidence is. The problem with cannabidiol is that there's so many different ones on the market. And the ones which are used for epilepsy in humans are normally very pure, and you know, you can't get them. They would be also far too expensive when you would use them in veterinary medicine. Talking about a couple thousand quid, right? So people use these enriched nutritional blends, and there has been now a study in Colorado where they have shown that they had an improvement in seizure frequency, but they didn't have more responder rates. But interesting as well, it was a blinded study. They did find in the dogs which were on cannabidiol that they had increased liver enzyme activity, and 2 of the ones which were on the cannabidiol also dropped out of the study because of side effects. So when you put dogs on it, just make sure you check the liver values and so on, that they are healthy. That's something we will have to monitor to see how things. And then this was not, you know, that was kind of the first one, but then there was a really nice new study where they've shown really nicely in another construct, cannabidiolic acid extract, where it actually worked quite well. So there is some evidence that it might work as an add-on. So it's something one needs to consider. So let's sum up. I know this. I mean, you're all English native speakers, so I hope you could follow me being passionate about epilepsy, and I could give you some insight. So at the bottom line is, it's all about quality of life, not only for the pet, but also for the owner. It's about, you know, what are the characteristics of the epilepsy? What is the potential brain pathology? Most of the ones we discuss is idiopathic epilepsy. Is there anything from a developmental aging point of view? Is there, what kind of treatment options do I have? And think about nutrition and environment and the behavior alterations. So thank you for listening. If you want to follow our research, Rowena still runs the RBC Epilepsy Facebook page. We do a lot at the moment. We're very, very active in Hanover. Some benefits of being back in Germany, where the research environment is a little bit more richer. You can follow us on Instagram or Facebook, and yeah, would be very honored and pleased if you do. And this is kind of my last slide, and I hope, like I said, you enjoyed the ride. It looks like Charlotte is still awake, which is a good thing. And yeah, so yeah, let me know if there were any questions. Yeah.
Perfect. Holger, thank you so much. That was really, really interesting, and I'm sure everybody has taken a lot from it. We do have 30 minutes remaining. We do have some hands up. I will ask anybody that has their hands up just to type their question, if they can, into the Q&A. We have had quite a lot of questions that have been sent in advance, so I'm quickly going to try and just go through 3 of those. And then we will come to the Q&A questions as well. Between this and the content we received, hopefully we'll get through all of the information, but we also will follow up after the webinar with more detail. So let's get to the questions. The most commonly asked question that we received in advance of the webinar was, is there any evidence-based link between diet and epilepsy, for example, grain versus raw? And I know you touched upon this briefly, but I didn't know if there's anything else you wanted to add.
Yeah, the grain debate is quite an emotional debate. So so a couple of things. We didn't speak about epilepsy mimicries. We didn't speak today about conditions which look like epilepsy but are not. And that's something a good veterinary neurologist will check, right? So is it actually epilepsy where they don't respond? We do know that there are certain movement disorders, paroxysmal dyskinesias, they're called, PKD, that they have a link to nutrition. So there's a nice study from Mark Lowry together with Laurent Garosi where they have shown, and we kind of knew this, so we knew when we are feeding these dogs a special diet that they improve, but they'd shown it very elegantly, the link between. So they found some autoantibodies against these molecules which are in gluten, which you can test for nowadays, and that's what we do. And then they changed the diet, and then the clinical signs improved. They had less of these signs, and also, and also the serology improved. We're just soon to be published, done this now. They reported in border terriers. We have now reported in multiple other breeds, and we have even re-challenged some of the dogs. So we gave them a diet again, including gluten, and then they developed signs again. So there's a good link to that. In epilepsy, there are a lot of people who believe there might be a link, but it's not really as proven, I have to say. Raw meat diet, or raw meat diets in any form. So barfing. The challenge is, as you all know, if it's done properly and hygienically, I have nothing against it. We know from a publication from Jan Sugodolski, who's kind of the god of microbiome research, we do a lot of work with, together with Stefan Unterer from Munich. They have shown that when you bath a pet, there are some GABAergic substances come. And then that fits to what owners reported, that they put them on bath diet and added MCT oil, and that improved dramatically the seizure control. So for my, I have nothing against this. There's never been a study yet, but I guess that's something which there's a positive effect. Sorry, Charlotte, this will be long answers for short questions. Yes. But it's multifaceted. The only thing, guys, I want to make you just aware, and not sure how it's now in the UK handled. We have seen, and there are some studies now where people bath their pet, and when they come into the hospital, they're more likely to have a multi-resistant bacteria with them, right? So we do know that there's a higher risk of infections, not only that they have, hygiene issues or certain bugs like Toxoplasma neospora or and so on, but there's also a higher risk of dogs when they go into clean surgeries that they actually carried a multi-resistant bug with them. It's just something one has to be aware, right? So you have to balance it.
Perfect. Thank you, Holger. So our next most popular asked question was, what's the best strategy for breeders to use when epilepsy is in our lines?
Yes, so these are the normal questions. So the first thing I think I've shown you today, and if you think about how much money went into finding genes, and the same is in humans. So we think in human medicine now 1 to 2% are causative. So you found the gene, and because of this gene defect, they definitely get it, right? But reality is, it's more like I said to you earlier, like a stack of cards. And then the question is, what happens with the environment if you ever will get epileptic seizures or not? So anyhow, even if it's not causing disease, so to speak, and it's only a risk factor, still you don't want to have this in your line, right? So even if it makes it more likely, and you never will find the gene, I would not breed. I mean, try to do a segregation analysis, do a little pedigree analysis, and I'm sure, you still have a very, I mean, the UK is one of the best, having a very strong genetic center, and look at this just systematically. And then I wouldn't breed, I wouldn't breed with a male dog, definitely not a male dog, because we know that, they might be more affected, but also not with a bitch who had a couple of them. It's just not worth the hassle, right? But that doesn't mean that the whole breed is affected. So we did I mean, with Dan O'Neill, we did a couple of studies, as you guys know. Sorry, my bum is falling asleep. We did a study where we looked at that Compass database, and that was really interesting because, for example, the Labrador Retriever often comes up as the one breed who has often epilepsy, but actually, when you compare it to the background population, to all the Labradors which come into practice, it fell out again. But we do see some families which do have a higher chance, and if you look in the consensus papers, we said the normal prevalence is 0.6 to 0.7%. So if you have, we said 3 times this figure, so let's say make it even easier, 3%, then you have a higher likelihood in that family, right? But there were some which had 33% in some breeds been reported. I think one just has to be careful. Yeah.
Perfect. Okay, this is a slightly related question, but also trying to link a couple of the questions. So quite a lot of people who've emailed in advance are really interested in whether there is a hereditary basis to epilepsy, and also if there's any updates on genetic marker testing, or how likely it is there will be a DNA test for the breed. And then really sort of linked, and in addition to that, if there is current research being undertaken.
Yeah. So, yes, like when I answered the question before, yes, there's a hereditary basis. No, there are very few causative genes, and yes, there are risk factor genes, and we definitely know that. So, and that makes it so tricky. It's like many, when I had the complex simplicity, it's a complex trait, and that makes it so difficult. So even let's say the Belgian Shepherds, and you have the Adam 23. Let's say, this is just a risk factor for more severe phenotype. So if your dog doesn't develop epilepsy, well, you have it, but makes no difference, right? But if it actually has epilepsy and you have a defect in it could make it difficult to manage. Is there research going on? Definitely there is. So the most successful research is examples like, for example, the Rhodesian Ridgeback example from Andrea Fischer, where they have shown, that it has a very specific epilepsy phenotype, but they with the lights, you remember, which I shown you earlier, but the normal ones, I think it would be very difficult to really nail down that there's one gene. Yeah. So sorry, I'm sure this has been frustrating, and I know obviously I've worked with other breed issues, challenges, and often these complex diseases are just so tricky. Yeah. And then the thinking has changed as well. It's not just what you're born with. We know that things change during your environment around you as well. So that makes it the epigenetic stuff. It makes it even more challenging, right? But you have, I mean, at the Kennel Club have some fantastic geneticists. I'm sure they can help.
Fantastic. Thank you for that, Holger. I know you've touched upon this, and you did include this in your talk, but we have had a high number of queries, and I'm just looking down the chat. We've also had some comments on this. So this question relates to, are there any benefits of using CBT, MCT oil?
Yeah, so MCT oils, I think I shown you earlier, there's now 3 studies which were controlled, and MCT oil definitely. As a rule of thumb, studies are a snippet at the end, and then you get also clinical evidence. So 25 to 30% I find do respond quite well to the medium chain triglyceride oils. If they respond, they often respond over time even better. There are, however, other dogs which don't respond, and then it doesn't. I think it's a no harm, and it doesn't cause any sedation. That's why I would recommend to use it. It doesn't cause the ataxia, sedationness. The CBD, I have also nothing against it. There is some more evidence now. I shown you the 2 studies, and I'm sure there will be more studies coming out. The problem there is it's a little bit like potassium bromide used to be in the UK. I'm not sure if some might remember. It was first not licensed as a drug. It was a license. It was nutrition. It was an additive. And because of that, it was not so strongly regulated. So you don't know what's exactly in the bottle or in the pill. And then obviously the regulators, they said, okay, this is not good enough. We need to regulate it. So be sure that there were tons of potassium bromide sold each year as a drug, and that's why then there was a licensing procedure, and now they are licensed product. And I think the same needs to happen to CBD, because just because it's CBD on the label doesn't mean it's in there. But we do know now that it can have an effect. I actually think as well, necessarily it might not only be the anti-seizure effect, it might also be that the dogs can sleep better, are calmer, less anxiety, and that might also have a positive effect on the epilepsy itself. Yeah. But when you give it, make sure you monitor it. It's not just because it's natural, it's safe. It could be, that they might get increases in their liver enzyme activity. They might get liver problems. We don't know that yet. We only know from the studies that they had increased liver enzymes in some dogs, and that need to closely monitor them. Sorry, that was a long answer again.
No, that's perfect. Just a quick reminder to everybody, I can see a few hands up, but you will need to type in your question, I'm afraid, and that's the best way to get your question to us. Just very quickly moving on then. There's a couple of questions here around whether medication can trigger seizures, and whether there's any modern medicine or technologies that are able to intervene in any way.
Well, there has been some speculated that they can lower the seizure threshold, and the classic one, which is used as a sedative often in practice, was as a ACP, as a promicin. The thing is that there has been then studies which have shown it had no effect, right? So theoretically, yes, it's possible, but apart from toxins, like dark chocolate, and stuff like this, which could obviously affect and lower your threshold, I wouldn't worry. I do think that dogs which have hyper, who have a bit of ADHD, are more prone to have seizures in general. That's definitely a risk factor. What do? We use the normal arsenal of drugs, which I've reported, and obviously now use the diets. We also look for trigger factors. Some owners know that certain sounds or certain flashy lights, like in the television when they say you might have some flashy lights, and the reason is because that could synchronize your neurons, and that can cause seizures. You can remove those. We look at these. We talked about nutrition. We go actually to the next level at the moment. We transplant the microbiome from dogs which are well controlled to dogs which are not well controlled. So there's some movement in that area, looking a little bit more aggressively at the influence of your gut microbiome. And then we have done some studies now where we also implanted devices to stop seizure kind of spreading in the brain. We've done this as well. So there are, these types of options. Unfortunately, you feel that every time you think you have a weapon, then some of them just don't respond. And I think that the problem is that it's such a versatile disease, and we need to get better in identifying which one might respond to which drug and treatment.
Thank you for that. And we have a question about whether there's any possibility of a link between weather conditions, atmospheric pressure, energy, and whether this has any impact on whether a dog has seizures.
Wow, that's a good question. The same with the moon. There's a study where they looked at the moon. They didn't find really any correlations. With the weather, it's the same-ish. Saying this, we often hear it reported. No, so yeah, I know that that the people have found it quite consistent, but when you look at the whole population, same as with vaccination or antiparasitics, we couldn't find this being a risk factor. But obviously it doesn't mean that for an individual patient it might not be.
Perfect. We have a question about whether there is any link between epilepsy and inoculations. Should dogs with epilepsy be vaccinated?
Yeah, that's what I meant. I mean, there's a study where Claire Rusbridge has looked into this and presented at BSAVA. They couldn't find a link between this, but if you have, for example, a little bit of and we have seen this now. I mean, we are all experts in vaccinations nowadays, aren't we? So we know that if you have certain people have a more inflammatory response, and the same happens in the brain, and it could be that some have a more reactive inflammatory response, and that could cause seizure activity. But overall, when we looked at it as a population base, we couldn't find it, and Claire couldn't find it either. So yeah, and that makes it. I know it doesn't make it really helpful. I think the risk of not vaccinating your pet, and you guys in the UK are really protected, because I see a lot of pets coming from Eastern Europe. I don't know. I think we forget as soon we save. But if you see a couple of distemper puppies, that's an awful disease to have. So I would rather vaccinate my pet.
Perfect. There's quite a lot of questions continuing on about how many seizures a year are classed as a controlled epilepsy, and linked to that, are there any known conditions that cause secondary epilepsy? So there's a lot about the kind of control and the some of the topics in your talk today.
Yeah, sure. I'm sorry, I was probably not as clear. So we define nowadays success as 100% seizure freedom, but we do know that this is not always realistic. So we want to have a drug at least to have more than 50% reduction of the seizure frequency, but at the same time, obviously thinking about your side effects. Most owners tolerate one seizure every 3 months or 2 seizures in 6 month period. So that's what we also aim for, to have at least that control, ideally better. Yeah, it's a very good question. And then the second one is, so there's a million of reasons why you can have epilepsy. We do know that anything what changes your brain structurally, like a tumor, like an inflammation infection, like a cystic anomaly type lesion, and so on, they can obviously lower your seizure threshold, make your water boil too quickly, your brain to seizure too quickly. We also know that you can have reactive seizures, meaning you have an intoxication. And difference between epilepsy and reactive seizures is, reactive seizures means just when you remove the intoxication, or we had dog who ate too much salami and then had too much sodium chloride, had a salt poisoning, and that dog also developed seizures. But when we removed, obviously, salami, we removed the theobromine, we remove the toxins from the liver, suddenly the brain works fine again and it doesn't continue. But when you have epilepsy, you have a brain disease, and that's why you get all these other comorbidities. I mean, the brain is altered in general.
Great. And I think we'll just do one last question, and then I will try and wrap up, and obviously we'll try and address anything out of the session this evening. So we have one last question relating to whether hormones, for example, bitches being in season, whether this has an impact.
Also a fantastic question. So we published about this as well. I have a fantastic PhD student who was in Sweden, and in Sweden they don't. I was just last week actually in Sweden, but they don't neuter and spay so much as we do, and there you find two types of characteristics. So it's called catamenial epilepsy. So it's hormone-related epilepsy. So I would advise that you look at when the heat was and the time in between, and if the seizures always get more severe relating to that, because we found two types of cycles. Some who were inter-estrus and some had during estrus, right? So you would have to look directly in that individual bitch, right? In male dogs, also Sophie did a study. We found that male dogs are more prone to have epilepsy. We know that male dogs are more likely to have drug-resistant epilepsy. And then when you look, there were quite a few studies where they've shown, that male neuter dogs is a risk factor for epilepsy. And I was like, probably there's a bias because people, when they obviously have a dog with epilepsy, they neuter the dog. But then Sophie did a very nice study, again, using the Vet Compass database, where she followed the dogs. So she looked at them when they first came to the practice, and then when were they neutered in course of the disease. And saying this, the dogs which were male entire had later seizures than the males who were neutered. So they had earlier. So that would speculate that actually there might be an effect. This is obviously not controlled, right? But it's an interesting cohort study.
Thank you, Holger. Honestly, from everybody this evening, thank you so much. We have an article on the Kennel Club website on our A to Z about epilepsy from yourself and Marina, and we'll definitely come back because there's been so much interest in this topic. There's so much that we could have covered as well. There are so many questions that potentially we haven't quite had time to discuss and answer. So we will get back to you, and we will try and enhance and grow the information we have available on epilepsy on the Kennel Club website. You referenced a really good tool, and I just wanted to come back to it for anybody interested. It's called the Royal Veterinary College Pet Tracker app, and I think if you Google or go on for the Royal Veterinary College and you put in the Pet Epilepsy Tracker app, you will find that, because I knew you referenced that as a really useful tool. I'm sorry to anybody who didn't get a chance to ask their question. We will try as much as possible to get as much information out there and available to you on this topic, and create a community around these webinars as we progress and evolve how we do this. If you do need to contact us, if you want to follow up on anything, you can always contact the health team at the Kennel Club at health@thekennelclub.org.uk. I want to take this opportunity just for anybody to say thank you virtually to Holger, and we really look forward to working with you, Holger, and we look forward to offering more webinars to the dog community this year. Thank you, everybody, and thanks very much, Holger.
Thank you, guys. Thank you for listening. Bye now.